The boys and girls of summer are filling the ballparks nightly. And with every pitch thrown across the plate, there is a risk of injury. In fact, 1 in 4 young athletes will complain of shoulder or elbow pain. So where do you turn? We have Dr. Tim Duffey, a board-certified orthopedic surgeon with OrthoNeuro, joining me now with some expert advice. Dr. Duffey, I was kind of surprised, first of all, to hear that stat, right? 25%, I mean, that's kind of a lot of these young kids. So what ages are we talking about?
Usually the ages of 9 to 14. Those are the ages where bone, cartilage, and tendons are developing. They're not a child, but they're not an adult, and they have a lot of changes going on in their life at that time.
And that's the thing is, when you're 9, when you're 10, and you're getting this sports injury, you're thinking about probably long term, maybe, you know, as a parent saying, is my kid going to be able to do this, you know, if they hope to play college or high school sports? Do they have long-term effects at that age then?
Yes, they can.
Okay.
You can injure the growth plates, which are make the bones longer. You can injure the tendon attachments. You can also injure the articular cartilage. The surface of the joint can be damaged in these injuries. These injuries aren't acute usually. They're not like something you fall down or it's a one bad pitch.
Okay.
They're cumulative. So it happens to do with the overtime and overuse.
And is it just, because baseball's not a contact sport, obviously, so when you mention that, I mean, is it the constant pitching, the number of times they're doing this, the way they're, I mean, what is causing that injury?
That's correct, Robin. Pitch count is very important, and that's one thing parents can take away. In a season, a player should be about 600 to 800 pitches a season to be in a safe range. So if they're playing 10 games, 60 pitches. Might be a good number. So pitch counts are very important, but also the amount of throws and how much force is in the throw, whether their mechanics are good enough. Do they have enough rotation in their shoulder? Do they have any back problems? Do they put their weight in their throw?
And let's look at this because we got some video, kind of a bad pitch versus a good pitch. So you need to, immediately kind of correct that? Should coaches be looking for that? I mean, if that can make such a big difference, right? Are we kind of trying to, the sooner the better, attack that? Or?
Correct. Proper coaching and training is very important at these ages.
Okay, so anything they can do then when we watch this to really avoid these injuries?
Well, on the right is the person in red, and you'll see that he moves his weight forward, he rotates the shoulder well, and he gets the elbow above the shoulder during the throw. And those are important parts of the mechanics to keep it correctly. On the left, the person in blue, you'll see that the elbow dropping below the shoulder, there's not a good step into the throw, and there's loss of rotation in the shoulder, all those three things. Now, you can have any one of them individually. You can also have a lot of variables as far as their ankle pain or whether they have a knee injury. All will affect their throws and give them shoulder pain. Okay,
so let's talk about treatment. First of all, right afterwards, as a parent, can they go home? Is icing going to help? Is heat therapy going to help? Or do they need something more serious? How do they know?
Well, acute injuries, icing can always help, 10 to 15 minutes max on the icing. But they're going to know there's a problem when there's pain that's not acceptable. Pain at nighttime is very important. They also show disability or maybe protected motion. They won't go to pick something up as much. They won't act naturally. Those are the times if you're out of the game, if you're having pain, you're not using the joint correctly, you may want to see a physician.
And you know those kids are going to try to hide it because they want to play. So you gotta look out for that. All right, so let's talk then, you know, physical therapy and surgery. Are those common treatments as well when you get down the road a little bit?
Physical therapy is more common. Surgery is rarely performed in this age group of 9 to 14. A lot of times the injury goes way past the recognition stage and they break a bone, and that can happen. They can break their growth plates. But typically, 90–95% of the time, these injuries can be treated with proper rest, proper rehabilitation like physical therapy, and then proper return to sports.
And so when it comes down to that kind of addressing maybe proper coaching and things like that, you know, does a parent step in and say, my kid's having these issues? Should they always let the coach know, hey, we're dealing with this, let's try to kind of fix things?
I think parents are often involved.
I was going to say, wait a second.
Sports.
Parents are always like, hey, coach. Yeah, maybe they should back up.
They're often probably in their ear many times. But you also have to introduce rotation to the ball later on in their careers.
Okay.
If you introduce curveball sliders where it takes a lot of torque and force into the joint, for the younger ages, the adolescent throwers, that can increase their injury rate by 50%.
Okay.
So that's very important.
Yeah, I think being educated, obviously, always a great first step. And then if there is any pain, any injury, just contact a doctor who knows, can look for it and kind of address those issues. OrthoNeuro.com website, phone up on there for you. Dr. Duffey, thank you for being here.
You're welcome.